The following segment is sponsored by Unity Healthcare. We are seeing an increase in COVID-19 infections in the area. So today we are checking in with Dr. Jessica Henderson Boyd, Chief Medical Officer at Unity Healthcare. Let's talk off first. What does this mean for the minority communities?
Well, good morning. And it's really important for me to be able to be here today to talk with you about the increasing COVID-19 infections, particularly in the African American community. In the Washington, D.C. area, we know only about 30% of African Americans are vaccinated right now. And the majority of the infections being caused by the Delta variant are in unvaccinated persons. So that puts the African American community at greater risk. And we also know that 96% of the deaths happening from COVID since May are in African Americans. So it's really important that we pay close attention to this issue now.
So there may be some concerns that the vaccine doesn't protect against the Delta variant. What should people know about that?
So the current vaccines are actually highly effective against the Delta variant in preventing hospitalization and death. So while we have seen some breakthrough infections come in people who are fully vaccinated, it still provides that really important protection against severe infection. Also, the breakthrough infection rates are still low compared to those in unvaccinated. So it's really important to get as many people in our community vaccinated to help reduce the surge that's happening and also to protect ourselves and our loved ones.
For those watching right now that are fully vaccinated, should they be worried or do they need to do anything?
I think the precautions that are happening in DC right now are helpful. So continuing to wear your masks when you're indoors is really important. And we have to remember we have some in our community who can't be vaccinated, whether they're younger or maybe the vaccine is less effective, like if they are immunocompromised. So even if we're vaccinated, it's really important for us to be wearing our masks and maintaining some social distance to reduce the spread of the virus.
So many kids going back to school and children under 12 still are not able to get vaccinated. What additional measures can we take to protect them?
So really getting to that community immunity level, really closer to 80% of vaccinated is really important, but also teaching our kids to wear their masks safely so that they're wearing them indoors, they're maintaining those social distances, and really important, like every season, is hand washing. So being able to wash your hands or use hand sanitizer frequently throughout the day and making sure that the children are doing that effectively is a great way to reduce the spread of infections, whether it be COVID or the flu or any of the other viruses circulating right now.
And there's been new information about additional doses and booster shots. Can you tell us a little bit more about that?
That's a great question. So we now know that additional doses are available for those who might have a moderate or severe immunocompromised condition. So perhaps the original 2 doses were not quite as effective because of the immunocompromised state. So an additional dose at 28 days later will help boost the immunity in that group. We also are looking forward to later in September, a booster shot or a 3rd dose for the rest of the community who's received 2 doses to help boost immunity about 8 months after that 2nd dose so that all of our antibody levels are up and we're ready to protect ourselves from variants and from COVID-19.
And doctor, in our final seconds here, can you tell us what Unity Healthcare is doing to continue to fight the pandemic?
Thank you. Unity is having respiratory and evaluation clinics. We have 5 of them set up around the city in the evenings and weekends or during the day for testing because that's important right now. We have COVID vaccine clinics also across the city. You can walk into a clinic, you can schedule an appointment, you can bring your family. It's really important for community immunity. And we're also continuing primary care services. So it's really important to optimize our health during this time in the case that we might be exposed or be at risk for COVID to be as healthy as we can be if that were the case.
Such useful information. You've helped so many people today, and we thank you so much for your time.
Great, thank you.